Dad, is Medicare free?
Unfortunately, no. Medicare is not free. And this may come as a surprise to a lot of folks out there because this is one of the most common misconceptions out there about Medicare is that it's free. But whether we're talking about original Medicare or Medicare Advantage, there are premiums, there are deductibles, co-pays, co-insurance, all expenses that you need to account for, you need to think about when you're considering whether or not you're ready for retirement. Because if you don't think through all of these expenses, well, you may come up short. So let's start with original Medicare. So Medicare Part A, inpatient hospital coverage. So for most people, they'll be eligible for premium-free Part A. So that means that you've paid into the system for long enough, or your spouse has paid into the system long enough, or even an ex-spouse has paid into the system for long enough. You'll be eligible. You'll qualify for premium-free Part A coverage. And that's great. That's great, but we still have Part B. Part B, outpatient medical coverage. There's a premium associated with Part B, and for 2023, that premium, that monthly premium that you have to pay every month, it starts at about $170 per month. And I said starts at $170 per month because if you reach certain income thresholds, well, you're going to have to pay more. There's a surcharge that you'll have to pay in addition to that base premium of $170 per month. So think about that. And that income threshold, that's from 2 years prior. So if you are enrolling in Medicare in 2023, well, Medicare is going to look at your income from your tax return from 2021. So if you're thinking about selling stock, you're thinking about taxable Roth conversions, you're selling a business, think about that. Think about the timing of that because 2 years later, it will impact your Medicare Part B premium. There's also a deductible with Medicare, deductible with Part B. There's a deductible with Part A as well that you'll have to cover. What gets folks with Medicare Part B is the co-insurance. It's 80-20, meaning Medicare will pay 80% of covered services. You'll be responsible for 20. Now this can get really expensive if you have a lot of healthcare expenses, a lot of Part B expenses, because you're responsible for 20% forever, and there's no out-of-pocket maximum. That's another thing that surprises people. There's no out-of-pocket maximum, but there's a way around that, and that's called Medicare supplement or Medigap coverage. So if you're enrolling in original Medicare Part A and Part B, you're gonna need a Medigap policy, a Medicare supplement. Now you've probably heard about those. Those are the plans that are A, B, C, D, F, G, K, L, M, N. Those are Medicare supplements. Now what those policies do is they take care of some of the expenses that you'd have to be responsible for if you just had Medicare Part A and Part B. For example, co-pays. Once you reach your deductible with Part A, the Medicare supplement can cover those. Co-pays from Part B, that 20% that you're responsible for, that Medigap policy, that Medicare supplement can cover those for you, will cover those for you. Now you have to pay for that. That Medigap policy has its own premium. And you get that Medigap policy from a private insurer, and they dictate the premium. And that premium, depending on how comprehensive of a plan you want, can range, and where you live, that premium can range from $50 a month to all the way up to a few $100s per month. So right now we have original Medicare, we have Part A, okay, no premium there, you're right, no premium. But you have the premium Part B for Part B, and that's about $170 per month in 2023. And of course, premiums go up. They will go up in the future, like all premiums do. So you have that premium, monthly premium. Then you have the Medigap premium that could be roughly $50 to a few $100s a month. And then you're going to want prescription drug coverage, Medicare Part D. Now, Medicare Part D, again, kind of like Medicare Part, the premium on Medicare Part B, There's a base premium that the private insurer that's offering the prescription drug policy will charge you, but there's also a surcharge based on income. So again, if you reach an certain income threshold 2 years ago, that will impact your Medicare Part D premium today. And the average policy Part D premium, about $30 a month. So again, and that plan may have deductibles, may have co-pays, depending on the formulary, which is the drugs that are covered, the tiers at which they're covered. You got to look at all of those things. But again, Medicare is not free. So you have no Part A premium, but you do have a Part A deductible. You have Part B, you have a premium, you have a deductible, you have co-insurance, 80/20. You have the Medigap policy, that's a monthly premium. And then you have the prescription drug policy, Medicare Part D, which also has its own premium. So this is all original Medicare. You may say, Brian, that's too much. Maybe it's Medicare Advantage that I heard was free. All right, well, let's talk about Medicare Advantage. Okay, and Medicare Advantage, that's just another way to get your health insurance, not through Medicare, but through a private insurer. See, Medicare Part C, that's Medicare Advantage. Now, the thing about Medicare Advantage is you still, even if you have Medicare Advantage, you still have to pay that Medicare Part B premium, that roughly $170 per month in 2023. You still have to pay that and the surcharge if your income reaches a certain threshold. So you still have to pay that. Now, the Medicare Advantage plan itself, now they may have a premium, but a lot of those premiums out there for Medicare Advantage, they're premium free. There are no premiums. So maybe that's where the misunderstanding came from. But you still have to pay that Part B premium to Medicare. Medicare Advantage, a lot of those plans, many of those plans also cover Part D. They cover prescription drugs. So there's no fee for that. But you will need to pay that Part D premium, that surcharge, sorry. You will need to pay that Part D surcharge if your income reaches a certain level. Right? You'll have to pay that too. So again, it's not free. The premium from the plan might be free, but you still have to pay that Part B premium to Medicare. It can be deducted out of your Social Security check. And then if your income is above a certain level, you'll have to pay the surcharge for Part B and the surcharge for Part D. One of the good things about Medicare Advantage is a lot of times it will cover things that are not covered by original Medicare. So vision, dental, hearing aids. A lot of times that's bundled into that Medicare Advantage plan. Benefit of the Medicare Advantage is lower premiums. The Medicare Advantage premium will be typically less than the Medigap premium. Yes, but then you'll have co-pays, co-insurance. You could pay on the back end. So if you have a lot of medical expenses, a lot of healthcare issues, you may want to think about the comprehensive coverage of the original Medicare with a comprehensive Medigap policy, the most comprehensive Medigap policy. If you don't have a lot of medical expenses, things are going to be light, then maybe, just maybe, it makes sense to do Medicare Advantage, but it pertains to your own financial situation. In any event, Medicare, as you can see, is not free. Whether it's original Medicare or Medicare Advantage, you have to take these expenses into account when you're deciding whether or not you're ready to retire. Because after all, you only have one chance at a successful retirement. So choose accordingly.
I got it. That makes sense, Dad.